Okay, it's a pleasure to introduce you to what is happening in France, because we are very proud of this project, which is to produce a unique gateway to health data really at national level. So this project is embedded in major public policies. We had a report known in France as Villani report about data sharing platforms necessary to foster artificial intelligence research. And also we have a national strategy for artificial intelligence, which was delivered 3 years ago. And this Health Data Hub is one of the flagship project of this strategy. So it is a public structure, the Health Data Hub. It was started in almost 3 years ago. In December, it will be exactly 3 years ago, to facilitate access to health data for research only for projects of public interest. That's very important. It's not for private interest, it's for public interest. But if a commercial structure wants to use the data and the project has some impact on public interest, of course it will be accepted. So this project has includes key services, and the first one is a unique gateway to access data. You know that accessing data from other structures is always a big challenge, so it's a way to help and support researchers in that challenge. But it is also a collection of databases, public databases, of course, but also both real-world databases and scientific databases, as I'm going to tell you. But it also provides a state-of-the-art and secure technological platform, which is almost inaccessible for most research institutions. And also it's a project bringing together key stakeholders and creating a real culture of data sharing in the country. So currently the Health Data Hub has about 80 collaborators, and the target is to have 100 by the end of this year. And it runs a budget of 21 million euro per year. So the governance is quite complicated, as it is a public enterprise, you know, and the governance has to reflect all the agencies and ministries involved in the topic. So in a good sense, it's very good because it's embarking a lot of people, but also it's quite heavy, as you imagine. And so the services which are delivered must be free of charge for all researchers. And the structure of the project allows to charge, if necessary, marginal delivery costs. But this is not done currently, but it's possible in the future. So what is the unique gateway like? It is a support to access the current data and to help the researchers satisfy two agencies. One, the CESRES, is looking at the scientific quality of the project and its public interest, and also the ethical issues around the project. And then when you have the go from this structure, you have still to submit to the CNIL, which is our national committee looking at access to personalized data, personal data. And this committee is quite strict. I think one of the stricter in Europe. I think the Germans are not too bad as well, but our committee is really very difficult to satisfy. So it's the service is to help the researchers to apply to these two committees and to have a good dossier, not to waste too much time, but normally it could take months and months, over a year, to get the two permissions. So in the past 2 years and a half, we had this service delivered to 300 projects for the CESRES level and 520 for the CNIL level. So you see that there is a big demand, and this came mainly from hospitals, but also from from universities, and 25% of the requests were from industry. And they have, of course, to use a trusted tier like a CRO to apply, but they can be among the customers as well as the academic researchers. So this gateway, as I said, is very useful. What about the data health data hub content? We provide access to 3 main national databases. One called the SNIRAM, which is all the health services which are reimbursed by the national health system. So it gives access to all the consumption of care in the country, public and private. We have also linked to that the PMSC, which is the database containing all the discharge data from all hospitals, public and private. And we have also the CPDC, which is the cause of death database in France. And these 3 databases are cross-linked. So this is the main database. And you understand why it is so important to have a unique guichet, because, of course, accessing and using this big database requires a lot of skills and understanding of how it is built. There are, for instance, over 180 tables in the database and over 4,500 variables. So if you are not used to the use of this set of data, you cannot easily do the research you plan. So it's better to have a centralized structure for that. So in addition to this basic public database, we plan to incorporate also other more scientific databases beyond this national health data system. So this is the list of what the 10 which have been currently accepted. They have to, of course, satisfy all the GDPR requirements to be accepted, and also to have a strong interest in terms of research. So this includes some administrative databases, like some diseases have to be declared, or all the screening organized at national level have their data also in one of the databases which is included, but also some databases on breast cancer or on cystic fibrosis or myocardial infarction data, or emergency also care in public hospitals. So we can enrich in the future more and more this main central database. So the technical offer of the Health Data Hub also is very important to understand. What we offer are services which are extremely secure, with 2 levels of authentication, and also only the data necessary for the project are accessible in a private database, and all the exploitation have to be done on that without any transfer of data. So what the platform technological offer contains is really a state-of-the-art tools for project leaders. And we also offer a lot of facilities for the development of the project and project space. And so, and we facilitate data provision heavily. So I think that I don't know of many institutions able to do that easily. So, so what we also did in the past 2 years is to ensure data interoperability by the homogeniization of the data of the main databases which are included. And you know, for those who have tried to do that, how heavy it is and how difficult it is. So it's a big plus for final analysis of the data and interoperability between the databases. So this Health Data Hub is really a booster for impactful project. And so because we can link different data sources, and also because of this offer of computing capacities that we offer as well. So in principle, you know, it's going to allow a lot of projects which were never possible in the past. So concretely, what has been supported in the past 2 years, we have 70 projects, ongoing projects. So there are 3 ways to accept projects. The one is spontaneous submissions, but this does not work really well because the HDH is too young for it was not, let's say, established enough for receiving a lot of submission. We got 12 submissions from during the pandemic, and this was very helpful, of course. But most of the project of the 70 projects come from either 2 ways. First is that we launch a call for proposals where projects using the databases are supported financially, and the project leaders receive also all the support from the teams of the HDH. So this is the major way. And this is very much appreciated, and this is done in partnership with some other institutions like the BPI in France, which is the National Bank for Investment in Science, but also some big communities like the cancer community in France, Unicancer. And also some projects are directly scouted by the HDH, because they are strategic, and it makes sense to support them and to use them as demonstration projects. And so we have done several projects as well through this road. So I think the better aspect of what we do is to make available real-world evidence in a very secure way. And we have many partnerships which are very promising with the European Medicine Agency or with the Health Technology Assessment Agency in France, HAS, which is looking at the possibility to really rely on data generated by the Health Data Hub. We think that also to be really useful to the community, we need to establish more partnerships to enrich the catalog of database available to project leaders, and especially with the hospitals, because most hospitals currently want to have their own data repository, and they have a strategy for that. This is excellent, but I think that by partnering with the HDH, they will, let's say, be better supported, and they will develop a more harmonized, let's say, technological offer, and this will ensure interoperability between hospitals in the future, because, you know, the big danger is that every hospital runs his projects its own way, and that at the end we have a too large diversity of projects. We also think that we should work on thematic projects with large research communities, well organized, when they have really already harmonized resources. So cancer is an evident community to work with, but not only. We have other communities wishing to work with us, especially the rare disease community, of course. And also, we lack, for the moment, outpatient care data. They are totally absent from the main administrative databases that are cited. So there is currently a discussion with the community of GPs to develop with them a database which would allow to enrich the system with patient care at a first level. And this would be really excellent. And so what has been done in France, I think, could contribute to the prefiguration of the European Health Data Hub data space. We are one of the 2 prefigurative instruments which have been defined by the European Commission. So we are leader of the EHDS pilot, and this pilot will start with 3 or 4 concrete pilot projects where we could work with several countries and see whether we can really use data, cross-border data. And so the European Commission has not yet selected the projects they want us to test, but it is likely that they will be the 3 ones that I show on this slide. So one on cardiovascular pathologies events, one on thrombosis in patients with COVID-19, and one on predictive models for colorectal cancer, because these are 3 areas where the involved countries have big databases, big numbers of patients' data. So I think this is the most feasible projects. And if they are successful, it will be really very convincing for the community. So at the end, we are co-building and disseminating a health culture. So how do we do that? By creating meaningful content and events and disseminate them. So we have organized challenges, and we also organize symposium and conferences, especially one on artificial intelligence in conjunction with the MIT. The 2 previous years, it was a big success. I hope that the one in January will be also a success. So we try to do our best to promote this spirit of data sharing, which is absolutely necessary to acquire, to convince the community to follow and to take this offer seriously. So I hope I was clear enough, because it is a very complex project. And of course, I told you that as a fairy tale, we have problems as well, but maybe we will discuss that later. Thank you.
Thank you very much.